Senator Jackson.
Happy Women's Equality Day.
Happy Women's Equality Day. Senator Jackson, thank you for joining us. I would like to commend the senator who got here at 8:20.
Correct.
To sign in. So that's why she was number one on the list. You have 3 bills on suspense. You're waiving on 2, and you're presenting on SB 670.
That is correct.
Please begin.
Thank you, Mr. Chair, members, and thank you for the opportunity to present SB 670 before you today. This bill would reestablish the employer child care tax credit beginning January 1, 2016 until January 1, 2021, which would be comprised of 2 types of credits to help the establishment of an employer-provided or employer-funded child care program and the ongoing costs associated with that program. Specifically, the first tax credit would provide a credit for up to 30% of the child care startup costs or the cost for child care information and referral services up to $50,000 per year for an employer. The second credit would provide a credit to cover up to 30% of the cost of providing on-site child care with a cap of $360 per employee per month, again, for the employer to provide. As many of you know, we are currently facing a dire shortage in available and affordable child care, and the numbers are stark. As of the 2010 U.S. Census, the state had approximately 6.1 million children under the age of 12. However, according to the Department of Social Services, California only has 46,830 licensed child care providers and a licensed child care capacity to care for only about 1 million of those 6.2 million children. As a result, when fully enrolled, the state can only serve 16% of age-eligible children. Combine the limited quantity of available licensed child care with the growing demand for child care, and we see the impact it is having on access and affordability. According to Child Care Aware, California is the 13th least affordable state in the nation for infant and toddler care and the 17th least affordable for preschool. Currently, average child care costs for infant care, which is defined as 0 to 18 months, in California run about $12,000 a year. $12,000 a month. By comparison, the system-wide student fees and tuition for the University of California is $12,800 a year. It's almost the same. SB 670 is a necessary yet very modest common sense measure that will help offset the costs of child care for many low and middle income families, provide increased access to child care for working families, and revive a policy that is supportive of California's businesses to recruit, retain, and support working families. I understand this measure is going to suspense, which is why I believe it's important to impress upon you the importance of this from a fiscal perspective. And numerous studies have long demonstrated the fiscal benefits and savings of providing increased access to child care. By reestablishing this credit, we not only help uphold the state's commitment to provide a supportive business environment and increased access to affordable child care for working families, but we also help the state's bottom line. And with that, I thank you for your consideration.
Thank you so much. Witnesses in support.
Chairman Gomez, members, Matt Regan with the Bay Area Council. We're a business-sponsored policy advocacy organization representing about 300 of the largest employers in the San Francisco Silicon Valley Bay Area. Here to speak in support of the bill. This bill, we're here on Women's Equality Day, and as our members constantly tell us, they're having a difficult time retaining the top female talent in their organizations. And one of the principal drivers of that dynamic is the lack of quality, available, affordable childcare that allows working mothers to stay in the workforce. We're at over 50% of college graduates right now are female. but women entering the workforce still only make 78% of their male counterparts in compensation. And that's in large part due to the fact that they have to take long absences from work to take care of children. This bill goes some way to addressing that issue. And as Senator Jackson also said, it also has a twin benefit in providing quality child care for working parents, and we know that quality child care is the start in life and the start in the educational spectrum that sets kids, particularly kids from low-income and minority communities, on the right path in their K-12 and further education experiences. So we urge an aye vote. Thank you very much.
Thank you so much. Any other witnesses in support? Individuals from the public in support? Witnesses in opposition? Individuals from the public in opposition? Department of Finance?
No file.
Thank you so much. Questions or comments from the committee members? Seeing none, would you like to close?
I'd like to just provide you with a reason why this becomes so important. In a recent study by the state of New Jersey, they found that increased child care access resulted in 31% of children being less likely to need that expensive special education, and 40% of children being less likely to be held back a grade. Right there. There are other statistics I could give you, but right there, I believe, is a good example why this is an investment that pays off many-fold. Thank you, and with that, I look forward to your consideration of the measure.
Thank you so much, Senator. We'll take it up when we take up the suspense file.
Thank you very much. Appreciate your time.
And if franchise tax would cost, but you would think that they would have the same statement.
Mr. Leno? You have 4 bills on suspense, 1 due pass recommendation, and that bill is SB 731.
That is correct. Thank you, Mr. Chair, committee members. Without your objection, I'll waive on all 4 of the suspense candidates and just take up SB 731.
Thank you so much. Please continue.
Sure. So the bill very simply will require the child welfare workers and caregivers consider child's gender identity when making decisions about foster care placement. We know that these youth are at high risk of homelessness and abuse, poor health outcomes, suicide and depression. And when making these decisions, we should be respectful of who they are. The price of being different can be very high. We don't need to add to it. I'd ask for your aye vote.
Thank you so much. Witness in support?
Thank you, Mr. Chairman and members. Alice Kessler on behalf of Equality California. We're a co-sponsor of the bill and agree with the analysis that the cost should be minor of this measure, and also would just point out, as Senator Leno referenced, there is a higher proportion of LGBT youth in the foster care system, and it's important that they get the appropriate support so they can have better outcomes that will save us money in the long run. So we ask for your support.
Thank you. Thank you, Mr. Chair and members. Kathy Sunderling with the County Welfare Directors Association, also in strong support of the measure. The bill clarifies state policy related to transgender youth. Children who are brought into foster care have already experienced significant trauma, and as the analysis correctly points out, too often for our transgender youth in foster care, the abuse and trauma that they've suffered is related to their gender identity. We don't want to further re-traumatize these children. We want to respect and support them, and for those reasons, we agree the cost is minor and we support the bill.
Thank you so much. Individual from the public in support?
Rebecca Gonzalez, National Association of Social Workers, California chapter, in support.
Thank you so much. Witnesses in opposition? Individuals from the public in opposition? Department of Finance?
Department of Finance is neutral on this bill. We agree that it's clarifying of state policy, and any cost to DSS to update the state regulatory, make state regulatory changes would be very minor and absorbable.
Thank you so much. Questions or comments from the committee members? Seeing none, Mr. Leno, would you like to close?
Thank you. With no costs, with bipartisan support, and without any opposition, I ask for your aye vote.
Thank you so much. We have a motion by Holden, a second by Eggman. Do pass. This bill is out with Republicans not voting. Gallagher, no. Thank you so much.
Thank you very much.
That's interesting. He's going to do Laura's bill or Pan's bill? Pan has a bill too. Has Pan been here?
Yeah, state claims.
Has Pan been here?
No, he's presented.
Pan hasn't presented, has he?
No, but he's right here.
And Pan is here. Okay.
Dr. Pan, you have SB 145.
Okay.
Thank you very much, Dr. Pan. The floor is yours.
Thank you. Thank you, Mr. Chair and members. I present to you Senate Bill 145, which further clarifies that a hospital is prohibited from transporting a patient who is deemed medically unstable due to severe intoxication to another location, except when the patient is stabilized.
Move the bill.
You have a motion by Mr. Quirk, a second by Mr. Wood.
All right. Appropriately transferred to another licensed health facility. SB 145 is intended to stop and prevent this practice. There are only minor absorbable costs. I respectfully ask when I vote. Thank you.
Thank you very much. Witnesses in support.
Chair and members, Michelle Cabrera with SEIU California, and we believe that this clarification is extremely important to ensure that patients are not dumped out of facilities when they are in need of medical care. Thank you. We ask for your support.
Witnesses from the public in support. Anyone in opposition? Seeing none, Department of Finance.
The Department of Finance is opposed to this bill because we think it's unnecessary. We think it seeks to institute a prohibition on inappropriate patient transferring that already exists in state and federal law. We don't, however, see additional costs.
Thank you very much. Any questions from the members? Seeing none, this item is out on a B roll call.
Thank you.
Mr. Quirk, I believe you're going to present for Mr. Lara on SB 304. This is a claims bill, everyone. This has a do pass recommendation. Would you like to introduce?
Yes, Mr. Vice Chair and members. Today we're presenting SB 304, an urgency measure that appropriates roughly $3 million for specified funds.
We have a motion for approval by Mrs. Weber, and Mr. Wood has seconded this. Would you like to give a close?
I ask for your I vote.
Thank you very much. Is there any witnesses in support? Any witnesses in opposition? Department of Finance.
Department of Finance is in support of this bill. It gives appropriation authority necessary to pay the claims.
Thank you very much. Any questions from any members? If not, this is out on an A roll call. We have the consent calendar before us today, which is items 734, SB 800, SB 803, SB 148. I'll entertain a motion to. We have a motion by Ms. Weber, a second by Mr. Quirk. Is there anyone raising questions about the consent calendar? Seeing no one raise any questions to the consent calendar, that is out on an A roll call. I think the only remaining item is a review on the call for Mr. Block's bill, SB 538. Would you please call the roll?
Bloom, Bonta, Calderon, Chang no, Eggman I, Garcia, Rendon,
How many people voted?
Garcia's not here.
Leave the roll open. Call the roll
On 538. On 538.
on SB 538.
Bonta. Garcia. Garcia, aye.
Okay. Bill is back on call. We're going to hold the roll open for 10 minutes for the proponents to try to get their votes. If they cannot get their votes, we will adjourn the meeting.
SB 588.
Open the roll, tally the votes.
Call roll.
Call the roll.
Bloom. Bonta. Calderon. Gallagher. No. Gallagher, no. Rendon.
The vote is 7-5, 7-6. Bill fails. Notice reconsideration without objection. All right.
Okay, we're adjourned.